This is my video on 3D digital vitreous surgery. I am Dr. Natarajan and I perform 3D vitreous surgery. I don't have any financial interest, and we are using the Zeiss ARTEVO 800, and you can see me wearing the 3D glass. My fellow is wearing 3D glass and my nurse is wearing 3D glass. So that now you are seeing in the screen the 3 ports being made, and then after that I am now using the 3D, and then it's like watching the 70 mm screen and sitting and operating, and that's what I am doing now. And this is the case of proliferative diabetic retinopathy with the traction on the macula. So I am now inducing PED, and you can see that I am using the cutter mode and suction mode, and then trying to induce the PVD, and you can actually you have to really use the 3D mode to enjoy the 3D of this particular part of the video. And you can see now the transparent part of the posterior vitreous surface, and now I'm using the forceps to remove the to catch the vitreous membrane, which I'm trying to do it understanding the tactile sensation through the forceps to make sure that I don't pull too much and I don't produce extra traction, which will produce iatrogenic retinal break. And the advantage of using the 3D over the other is you can see a wide range of area and also depth, and then when you magnify you don't lose the depth, and that's the advantage of using the 3D. And here I'm using the proportional mode. I'm here in the vitreous machine where I push fluid between the fine membrane and the retina, and then and this is like doing a segmentation delamination using the vitreous cutter. And as you see here, I made sure that the posterior hyaloid is totally separated, and then you are cutting the membrane and also separating the vitreous membranes from the surface of the retina, and making sure. And now you see I made islands of fibrovascular tissue, and now cutting the one part of the island, and again making 2-3 islands, and then cutting it off, so that totally I remove instead of using a forceps and scissors, I'm using the cutter and using 10,000 cuts per minute, and then trimming the fibrous proliferation. And you can see mild ooze, and that's expected. And I again make sure that all the traction on the posterior pole is being removed, and I'm now using the diathermy, bipolar diathermy, to diathermize the vessel which is bleeding, so that recurrent hemorrhage not to happen. Again using the cutter. So this is an advantage where you see already excellent laser done, but in spite of that the fibrous proliferation progressed and then produced traction on macula. So now I'm releasing all the tangential traction, again using the proportional mode, and making a cleavage between the membrane and the underlying retina, and then using the cutter to do delamination and segmentation, and finally make sure all membranes are removed. So by this way you can also use steroid to stain, which will help. And the only thing is that in a microscope you will be seeing through the binocular, and here you are seeing using the 3D glass in the big screen, so all the people in the OT, the fellows, can learn. And at present I'm using the retinal brush to clear the surface of the retina, and again introducing the vitreous cutter, doing the same proportional mode, and then making a segmentation, and after that doing a delamination, everything with a vitreous cutter. And the entire idea is to remove the total fibrous proliferation which is there on the posterior pole, and slowly and diligently removing it. And I think this is where patience is required, and then you need a strategy planning and releasing the entire traction. You can slowly see that most of the traction is being removed, and using the cutter, alternatively using the suction, using bipolar diathermy, make sure that further bleeding does not happen. And you can see there was an existing round hole along the traction which has been identified, and then now you'll do endo laser around that. And here, along with the fibrous tissue, the blood clot is also being removed. And and then ergonomically you don't have to look into the microscope, which will again have tension on your back. So here ergonomically you can sit back and make sure that you don't have a back pain using this. But the only thing is, because you have to see the monitor in a side, there's a possibility of look a little towards one direction and operate, but it's a little better than operating on the microscope. Once I started using 3D, I routinely use for any procedure, whether it's a vitrectomy, scleral buckling, or any buckle removal. I think everything I do under the 3D digital microscope. And also the digital recording is excellent using. And now you see this fluid air exchange being done, and this is a view under air, and making sure that totally the vitreous cavity is dry using the retinal brush. The fluid air exchange being done, and this is a view under air, and making sure that totally the vitreous cavity is dry using the retinal brush. Make sure that all the oozes are stopped, and then you complete it by doing endo laser photocoagulation. And you can see the view, and the retina is totally flat. And then again at the final part, make sure there's no fluid. And now we are doing the laser around the pre-existing break, and the diathermy mark shows where were the breaks, and now again doing laser around it. Already there is a old laser marks around it. So the idea of the peripheral laser is to do a fill-in panretinal photocoagulation, and idea is to treat all the ischemic areas of the retina, and then make sure that all the things are done to reduce the recurrent hemorrhage. And at the end of the surgery, you are using silicone oil. So silicone oil air exchange is being done, and so that the patient, even post-operatively for visualization, is easy. And if you require a fill-in laser photocoagulation, which can be done on the slit lamp or indirect ophthalmoscope post-operatively, and you can see the 25 gauge being removed, and that's at the end of doing the surgery with the team with the 3D glasses on. And I thank you for watching this wonderful video. Thank you.